Okay, let's jump right in. Imagine this. A healthcare system where, your voice actually shapes your own care
Right.
and the whole system around you. That's really the promise behind patient-reported outcome measures, PROMs and PREMs, patient-reported experience measures.
Exactly. And these aren't just like vague ideas, they're actual tools, often standardized questionnaires.
Simple questions. Yeah.
Simple questions, asking about things that really matter to you, pain levels, energy, maybe how well you felt your doctor actually listened. It's about capturing your unique view.
Your perspective on your health, your whole journey through the system.
Precisely. And what's really striking is the evidence behind them. We're talking over 40 years of research now.
40 years. Wow.
Yeah, and it consistently shows that using these tools, these PROMs and PREMs, it can seriously improve how well clinicians grasp and document what patients actually need.
So better communication.
Much better patient-clinician communication. Yeah? Yeah. And that leads to better symptom management, improved quality of life. I mean, the benefits are quite significant.
Okay, better quality of life makes sense, but you mentioned other things too.
Oh, absolutely.
Mm.
Some studies even link their use to needing less healthcare down the line.
Mm-hmm.
So reduced utilization and, quite remarkably, even potentially increased survival rates in some contexts.
Increased survival from questionnaires.
Well, indirectly, right. By catching issues earlier, managing symptoms better, keeping communication lines wide open, it all adds up.
Okay, so here's the bit that's confusing then. You've got all this evidence, decades of it, plus huge investments globally. I mean, you hear about mandates in the U.S., national registries in the U.K.
Denmark's using them quite widely, integrated into their system.
Right. So with all that push, why aren't they just everywhere? Why does it still feel so fragmented, so limited in practice? It feels like a real paradox.
It is a paradox,
Yeah.
and that's exactly what this new research protocol we're looking at today is trying to get to the bottom of.
A research protocol.
Yes, a specific plan for a study. See, figuring out why good ideas don't always spread in healthcare, understanding those multi-level barriers, it's tricky. It hasn't always been studied systematically.
Right, it's complex, lots of moving parts.
Exactly, which is where these things called implementation science frameworks come in handy. They give us a structured way to look at the how, and this protocol is for what's called an umbrella review.
An umbrella review. Okay, that sounds comprehensive. What does that actually mean in practice?
Think of it like a review of reviews. So instead of digging through maybe hundreds of individual studies one by one,
Which would take forever.
right, or even just looking at one type of review, an umbrella review gathers all the existing high-quality summaries, could be quantitative reviews, qualitative, mixed methods, whatever's out there on the topic.
Gets them all together.
Puts them under one umbrella, yeah, to synthesize everything we already know. The goal here is to get the clearest possible picture of why PROMs and PREMs aren't being used everywhere, and crucially, what helps them get implemented successfully, identifying those, barriers and enablers across different settings.
Okay, so this isn't just for academics then. Understanding these factors, the why and how, that's got real-world implications, doesn't it?
Absolutely. This is vital stuff for policymakers trying to set strategy, for researchers designing interventions, hospital managers figuring out logistics, even clinicians on the ground.
It helps everyone choose the right approach to actually make this happen, to tailor strategies that work.
Exactly. To move past this sort of piecemeal adoption towards something much more integrated, truly patient-centered.
And you mentioned this protocol is particularly rigorous.
It is. It's using some pretty advanced methods. For example, it's built around a framework called the Consolidated Framework for Implementation Research, CFIR 2.0.
CFIR 2.0. Sounds technical.
It is a bit, but think of it as a super comprehensive checklist. It makes sure researchers consider all the different things that could possibly influence whether PROMs get used or not.
Like what sort of things?
Oh, everything from the design of the PROM tool itself to the culture within the hospital, government policies, funding streams, even the attitudes and beliefs of individual staff members. It covers multiple levels.
So it's a systematic map of all the potential roadblocks and green lights.
That's a good way to put it. And they're also using something called the grade circle approach.
Okay.
That's basically a way to rate how confident we can be in the findings about each specific barrier or enabler that the review identifies from the qualitative evidence. So when they say this is a major barrier, we know how strong the evidence backing that claim actually is.
Right, so it adds a layer of certainty to the conclusions. Makes sense.
It adds rigor.
Yeah.
It means the insights are more trustworthy, more actionable.
Okay, so bringing it all together, we have these powerful tools, PROMs and PREMs, huge potential, but patchy use. This umbrella review aims to systematically find out why and how to fix it using rigorous methods.
That's the core of it.
So, thinking ahead then, let's ask you, the listener, to imagine that future healthcare system we talk about at the start, where every patient's voice, captured through these tools, genuinely shapes their own care and the system. If you had to pick just one thing, what single factor do you believe is the most critical lever to pull? What's the biggest key to overcoming these challenges and making that vision a reality?